I'm an epidemiologist and I've worked in population health for most of my career, which started in England in maternal and child health nursing and then segued via various infectious diseases research projects into formal public health and epidemiology training. And since I've lived in Australia for the last 30 years, I've worked in public health units or taught public health in universities. So my entire approach to work has always been about population health. The work that I'm doing for the Murray PHN in terms of the needs assessment is to do a broad scan of population health. Now, these days, of course, health is more than just a lack of illness. It's very much thinking about the health as being broadly about social and emotional and physical and all sorts of different kinds of well-being. So I'm looking at a number of parameters and not just about whether or not people are needing to see a doctor. So that's really my brief, to do a broad scan using those kinds of parameters. It's very clear from the data that I've been looking at that the whole network is such a diverse area. It's not just very broad geographically, but it's very broad socioeconomically and in terms of origins of populations. And people talk about country areas being very homogenous, but that's not what I can see in the data at all. It's very clear to me that especially the general practitioners in this area, but the people that work in primary healthcare generally do a really good job. When they're doing service provision, they provide what is needed. The problems are much more to do with access to services, so that people that you can't measure what you can't see. So people that can't get to a doctor don't appear as needing help. So, for example, there are some quite big problems in terms of physical access and also economic access to healthcare. There are one or two areas of health need which are real standouts. Mental health being and associated issues like alcohol and other drugs and domestic violence, and those are probably contributing quite broadly to mental ill health in the area. And the way that mental health is presenting is very uneven. So I think a very much more specific look at what's happening with mental health is going to be needed. And apart from that, there is also a big question in my mind about how to better do preventive healthcare. So how better to do screening, how better to give people access to the kinds of services that at the moment are a bit piecemeal. We know the dental van comes around, we know the breast screen comes around, we know that those things happen. But it would be really quite good to think more broadly about a preventive service. That's what primary healthcare was originally set up to do. Primary healthcare is supposed to be about prevention. And we all know that services are becoming more and more stretched and strained. And it would be really nice to find an opportunity to go back to a much broader think about health and how to do prevention better, because prevention is cheaper than cure. And it's also much better for people.